Welcome to the Fix Harare podcast, brought to you by Harare News. My name is Tawanda Mudzonga. I'm the editor of Harare News, and joining me is Henry Munangatire, the managing editor of Harare News. Hi, Henry.
Hi, Tawanda. How are you today?
I'm good, and how are you?
Fine, thanks. Just keen to see what's happening with COVID in our city, as we're going to explore today.
Absolutely. It's the beginning of April 2021, and it's been just over a year since the first casualty from coronavirus. Today, we're going to talk to the head of Epidemiology and Disease Control at the City of Harare, Dr. Kudzai Masunda, about the coronavirus vaccine. Welcome to the Fix Harare podcast, Dr. Masunda.
All right, thank you.
Overall, I wanted to ask you, how would you say Harare has weathered the coronavirus pandemic over the past 12 months?
That's a difficult question, but I think we've just been doing what is recommended by the World Health Organization and also following, I think, the statutes that the government is implementing. And above that, doing, I think, our normal outbreak response, whereby we have got different pillars that look at different things, trying to make sure that we capture all the cases early and they are managed early. I think that's the hallmark, and trying to give information on COVID-19. We've also done a bit of research so that our interventions are research-oriented, or we give solutions that come from the research that we've done.
Okay. And how is the vaccine distribution going?
All right. Thank you. So the vaccination is also one of the strategies that we're hoping will also reduce the incidence of COVID-19 in this country. So basically, the government has sourced vaccines from various players, and they are distributed through our EPI program, which we already work with closely. So we are getting our vaccines from there, and I think that's being distributed also throughout the country from there.
Okay. Have there been any issues with the cold chain?
No, none at all. Because this is the vaccine that we have in this country have a cold chain that is similar to most, if not all, of the vaccines that we usually deal with. So basically, our system is structured in such a way that these vaccines just fit right in.
Okay. And can you give us the current total number of people who have been vaccinated so far?
Okay, so far in Harare, for the first dose, we vaccinated about 30,000. And then those that have received the second dose, about 6,000 now for Harare.
Okay, all right. And who is currently eligible for vaccination?
All right, so the vaccination was put into different phases, and we're still in phase 1, but I understand we're supposed to be moving into phase 2. But for phase 1, it was mainly looking at the healthcare workers, the frontline workers, and I think it was expanded as well to include even, that's healthcare workers. We're talking about people that in the various government departments who interact with the community, with communities daily, like the ZIMRA, the ports of entry, agri-techs workers. We've got the elderly and the vulnerable, and those that have got chronic conditions also being part of those that are being vaccinated in this phase. And we're also looking at the security sector. So all the security arms of the government, I think they're also eligible to be vaccinated. Yeah, so it was quite a huge list of people who were eligible. But now that we've received some more, I think that those eligible also is going to change.
Okay. And where can people in Harare go to get vaccinated?
Okay, so we started off with 4 sites, which was Salemu Gabe Hospital, Pararenyatwa Hospital, Wilkins Hospital, and Addict Government Clinic. But we have since now expanded to have more of our static facilities So we're having places like Marlborough Clinic, Heathcliff, Mavuku, also now coming on board for vaccinations. But we also have mobile teams that are moving, I think, to areas that either they've got a huge population of the people that were within our phase one, or those people could not move. Like, you can have people who are in the old people's homes. You cannot ask them to come to our facilities, so we'll also be going into the old people's homes. So we've got mobile teams that are also part of the vaccinators.
Okay. Which vaccines are currently available?
Okay, so far we are utilizing two vaccines, the one from Sinovac and the one from Sinopharm. But we also understand that the Covaxin from India is also in the country, but we've not yet started to utilize it. And we know that we'll also receive other vaccines in the future, so we'll just be prepared for them.
Okay. Does it matter which vaccine you get in terms of preventing death from coronavirus?
No, I don't think it matters. All the vaccines that are available, I think they're good enough to assist us, I think, in the process of ending this COVID scourge. So we would encourage people, I think, to get any vaccine that is available on the market. And here in Zimbabwe, we're using the Sinopharm, Sinovac, and Covaxin, and we know also the government has approved Sputnik. All these have been shown to be efficacious and can be used like what you are doing to combat this COVID-19 scourge. But even the others that are being used in other countries as well have also been shown to be efficacious. So if and when they are available also, people can still utilize them.
Okay. My final question is, you've mentioned that there are a number of different types of vaccines. When residents go to get a vaccine, do they have a choice in terms of which vaccine to receive?
Yes, as long as we are having different types of vaccines, people have a choice on the ones that they want. So that is available, I think, to the residents of the vaccines that have been approved by the government.
Okay. Thank you so much, Dr. Masunda.
All right, thank you very much for having
me. So, Henry, what do you think of Dr. Masunda's review of the City of Harare's current vaccination efforts thus far?
I think it's quite interesting. Of course, it's great to see that the city officials are making quite a pronounced effort, along with the Ministry of Health, to bring this scourge to an end. But there were a few things that I found interesting. The first is the issue of choice. It's a good thing that people are actually allowed to choose which vaccine they want, provided it's available at their healthcare center, that they go get the vaccine. I think that's very important for people to choose the one that they want to take based on the research they've done. It would have been good to see other vaccines also included that are part of the international effort, such as the Oxford, as well as the Moderna, Pfizer, and Johnson & Johnson. But I think the issue of choice is very important. The second is there needs to be more awareness. There's not enough information coming out of the City of Harare and the Ministry of Health regarding the side effects of the vaccines. What are the side effects people expect to experience? We also need to know the current effectiveness of each vaccine. So far, with the sample that they've taken of people that have been injected, how many? What's the rate of success? What's the rate of effectiveness? What side effects are people experiencing? And even categorize the side effects and saying this is the most common side effect. It's this. You should expect to experience this. I think information like that is very important for people to have as they make this decision to take the vaccine. The third is the pace at which the vaccination efforts are going. So far, 30,000 people in Harare have been vaccinated out of a population of 2.5 million or more, if you include the metropolitan area, which includes Chituwiza, Epworth, and Ruwa. So that's interesting because it just shows how much time it could take us to get everybody in Harare who wants the vaccine, or at least have herd immunity within the city, which I think the government is aiming for 60% nationwide. So if we're to get 60% just in Harare alone, it would take us quite a bit of time. And I think the last issue that came to mind as he was speaking was the issue of accessibility. Is how difficult or easy is it going to be for people to get the vaccine? Does it require long waits in queues? And what are the health risks of people waiting in long queues? Has it been decentralized to such a point where it will take a few minutes to get it done? Also, bearing in mind the state of our healthcare system, I think it's good that the vaccines fit into our current status of our healthcare system, and they're common to what we're used to using as vaccines, which I guess could be the reason why we've picked these 4 vaccines. But even that information, I think, needs to be made public. We also need to know, again, why did we pick these 4 and not the others, and the information around that.
Yeah, I agree with you, Henry. I mean, it was really good to hear him talk about it in a comprehensive way, because I think the information has been very piecemeal and not consistent, and it doesn't sow trust in the whole process, trust in the vaccines. It's all been very, very random. But it was good to hear that they've taken all the measures that need to be taken, as far as I can tell, to make sure that the vaccine has arrived safely, the cold chain has not been interrupted, and that, like you said, if you want to choose which vaccine you want, you have that option.
Absolutely. I think those are the most important things. People have to feel they can trust the system. They need to be delivered accurate information and feel that there's a level of trust in the whole process, because this whole thing happens so fast, and there are a lot of questions being asked due to are they safe? Because it's taken such a short amount of time to put them together. But then again, we live in an era of unprecedented technology and scientific breakthrough, so these things are expected. But then also, regardless of that, people just need to know exactly what they're taking and if it's safe. I think those are the big issues, and there has to be a big part of the roll-up every single aspect of the vaccine.
Absolutely. Thanks so much, Henry.
Thanks, Tawanda.
We've come to the end of this episode of the Fix Harare podcast, brought to you by Harare News. Please look out for the next episode, which will be available on Spotify, Google Podcasts, and Anchor, as well as on Facebook and Twitter on our handle @Harare News. Until next week, goodbye from us here at the Fix Harare podcast.